Welcome to the Quality of Life podcast, where we explore how hospice and palliative care may enhance quality of life for patients living with a serious illness. Here is your host, hospice and palliative care leader and educator, Dr. Millicent Burke-Sinclair.
Hello and welcome to the Quality of Life podcast. I'm here today with Taylor Gass, a music therapist at Four Seasons. Thank you so much for being here today, Taylor.
It's great to be here. Thank you.
Thank you. I would love if you would share a little bit about your background and how you came to be a music therapist.
Sure. So I started with a dual Bachelor of Arts in music education and flute performance, actually, but always had an interest in the health sciences and the medical world. So I met a friend who was studying music therapy and told me about music therapy. And I decided to pursue a Master of Science in Music Therapy when I graduated from my bachelor's program. I finished my Master of Science in Music Therapy at Radford University, which in hindsight was an incredible place to train because they put a lot of focus on verbal counseling and also guided imagery and music, both of which we use quite a bit here at Four Seasons, and completed a clinical internship at a not-for-profit hospice here in Western North Carolina and just loved the area, absolutely fell in love. And then after completing my board certification, was hired with Four Seasons, and I've been here ever since. So I've been with Four Seasons for almost 7 years. And I just really love the area, love the people, and love my team.
Well, we just absolutely love you and are so grateful for your contributions and your expertise. And I think you contribute day in and day out with our patients and families, but also with the team and helping to support the team. And so that's really important for listeners when they think about accessing care with Four Seasons. We have a full team that comes alongside patients and families to find out what's most important to you and how can we provide the best quality of care. So thank you for helping us lead in doing that.
Absolutely. Well, thank you.
One of the other questions I had for you is around music therapy. And specifically for our listeners, could you share what is music therapy? How is music therapy beneficial?
Absolutely. So at its most concrete definition, music therapy is the evidence-based and clinical use of music and music interventions by a board-certified music therapist to accomplish individualized goals within a therapeutic relationship. So it can support patients across several domains of function: physical goals, cognitive goals, emotional, physiological, social, and several other areas. We can work on goals with our folks. Music therapy is not playing music to help people feel better or playing music to cheer people up. It's regulated and a standardized clinical process and clinical practice. And all of our music therapists are trained and educated to be able to support the outcomes that are most important to our patients and their families. So a more natural definition is that music therapy is about connections. So all of us have a relationship with music from the time that we're born, whether that is the rhythm of our parents' heartbeat when we're young, all the way to a favorite song, a wedding song. Our job as music therapists is to identify our patient's relationship with music, to know how their brain and their body will respond to that music, and then to use those things in conjunction with one another, along with the relationship that we develop with our patients and families to help someone move from point A to point B in a way that's supportive for them, in a way that aligns with their goals. So that can be through the use of live music. Our music therapists play piano, guitar, percussion instruments. We sing, sometimes recorded music, but more often live music because we want to adapt things in the moment to best support what's going on in the patient's body and in their mind. We're always looking for signs that something is helpful or not and making adjustments along the way.
You know, when you were talking about that, there were two words that stood out about connections and relationships. And at Four Seasons, we truly do believe that we're able to positively impact lives by listening to what's most important. And that takes connection by really learning about the patient and their loved ones so we can develop a relationship of trust. You know, so often people, when they call us, it could be a little scary. And oftentimes, regardless of what level of care or what stage of diagnosis they're at, when they reach out to Four Seasons, it can be a challenging decision. And so for those who are listening, I encourage you that if you've thought about, you know what, my loved one just received a diagnosis that's serious and I feel like I need some help navigating, just call us. Because we have support services all throughout the stages of one disease diagnosis that we would love to be able to connect with you on. And sometimes that is something that is able to be supported through our palliative services or through our hospice services. Maybe it's a personal home care or a care navigation. But when we think about those patients who are at the point where hospice is appropriate for them and making sure that comfort, making sure that confidence, and making sure that their needs and the needs of their loved ones are being met. That is where I find so many beneficial mission moments and really life transforming mission moments that occur. And, I often think about music therapy as the root of a lot of those. And I think about it because of what you said, connections and relationships. Music and the therapy behind music therapy practice can not only be so relieving and comforting, but as you said, it's meets you where you are and helps you with the outcomes or those objectives that are important. And so for families listening, I have a question around how music therapy helps or even supports family members and caregivers, because we realize that so many of the services we offer across all of our service lines are beneficial for the patient as well as their loved ones. So could you talk a little bit about how music therapy is beneficial for the caregiver and the loved ones also?
Yes.
Thank you.
So in music therapy visits, we will often see someone open their eyes for the first time in days or articulate feelings of forgiveness or sing childhood songs that they haven't sung in years. And we hear our patients and families say that some of the best memories that they have with their loved one are the memories that they've made in music therapy visits while their family member is on hospice care. And that's remarkable to me. I think that someone's most treasured memories can be created in a time that could otherwise feel dark or scary or very austere and medical. But when families receive good care, they're able to focus on one another. And I think Four Seasons Care and music therapy specifically create this container around our patients and families to support them from every angle, to allow them to focus on what's most important to them. We also make an effort to support families in learning how to implement music therapy interventions on their own, so that in the days or the weeks between music therapy visits, the patient and family can still have access to that comfort and relaxation and rest. So that could be anything from learning to tailor a playlist toward a specific goal on their own, to learning how to initiate speech through rhythm to help someone communicate their wants and needs, to songwriting projects or helping them to work on non-musical legacy projects on their own between visits. And our goal as a hospice team is always to empower and support the patients and families to have the best experience possible, whether we're physically present in the home or not. And music therapy is a big part of that for lots of our families.
Thank you for sharing that. And it makes me wonder, for our listeners, are there any other examples that you'd like to share around how music therapy supports hospice patients?
Absolutely. So we might use songwriting or musical improvisation to help someone express their thoughts and emotions to a family member when saying something aloud feels too hard or there's a block, some kind of neurological block to doing so. We might use the principle of entrainment to decrease blood pressure or pulse or heart rate to help the body's natural rhythm to adjust to a place that's more comfortable for someone without adding medication that might challenge their ability to communicate and to spend as much quality time as possible with their loved one as they wish to do.
I just wanted to add something about that because I have seen that multiple times in action. And just to even be able to witness perhaps difficult breathing become more of that smooth breathing. You can just see the relief on the loved one's faces when the music therapist begins and you see that trend, that change. And so I want to thank you for pointing that out. And I think for our listeners, that's important to know that sometimes your loved one needs something that music therapy can make possible through your practice. And so thank you for sharing that. What else? What else do you think our listeners should know about this?
Well, we might use music to help someone relax. So to move through physical tension, which again can decrease the need for medication, support a more holistic definition of comfort, however someone wants to define that. We can help to alleviate pain and anxiety during wound care or bathing, which if someone's memory has been impacted by their diagnosis, those things can be scary. And to have music therapy present in a space can really change the whole of the space, can change that experience for someone from from something very tense and confusing to something very calm and peaceful and safe. And so we try to make joint visits with our CNAs where we can, with our nurses where we can, to provide that comfort care and just to make those experiences the best that they can be. We also might help patients address existential concerns through verbal counseling. So sometimes music for all of us will bring up feelings or emotions that don't come up otherwise, or that we're really good at pushing down. And so music sometimes brings those things to the surface where we can work with them. It makes the implicit explicit, what we always say in music therapy. And so we'll then use verbal counseling skills to unpack those things, to help patients and families understand where these feelings are coming from and to develop coping strategies or mechanisms or plans to support themselves and each other when these things come up again in the future. Sometimes these things are things that are coming up for the first time, and families are able to experience forgiveness or reconciliation around things that they would not have otherwise spoken about or discussed as a family. So it can be really valuable.
That brings up a mission moment that I witnessed years ago. And it was where a music therapist asked for the loved one's favorite song. And the loved one who was in our care had not spoken for some time. And the adult child knew the favorite song and said it. And after this was started, you would have seen the tears falling down the face of the one we were caring for, as well as the adult child. And the one who not spoken for a while said just a simple love you. And when you think about that, that is closure. That's an answer that so many people need to hear or want to hear. And so I love what you just said there is sometimes that's possible too. And I don't know if there's anything, if that makes you think of anything, but that was pretty life-changing for me to hear and to witness that.
I think that just highlights how important it is to know what songs are important to a person. I think that so often people hear about music therapy and assume that it's prescriptive, that we're giving a list of songs to listen to alleviate a specific symptom. But really, that relationship with music and the relationship between the patient and their families is what is so important and what we're after in music therapy, using music as the means by which to explore that relationship and to help those folks that we're working with achieve the outcomes that they want, whatever those may be.
Thank you so much for sharing that. That makes me think about another term around gift. And, oftentimes in life, we may receive a gift that once it's used, it's gone. But one of the things that I think is so special about music therapy is it is a gift in the moment that continues. And whether it's, as you shared, teaching the family or the loved ones how to continue to support their loved one who's in care in between sessions, or perhaps it's by a legacy project, as you mentioned. Or, and this is where my question comes in, could you tell our listeners a little bit about our heartbeat recordings? That is a massive gift, and I could only imagine how tremendous that would feel if I had that for my loved ones who have passed.
Absolutely.
Thank you.
So our heartbeat recordings are one of my favorite things that we do at Four Seasons. And through the support of our foundation and our leaders, our team has been gifted several ThinkLab digital stethoscopes, which are really state-of-the-art pieces of equipment. They're the most compact and the most powerful digital stethoscopes in the world. And so our team, with the permission of the patient and their family, can use these to create a crystal clear recording of someone's heartbeat. And then we can share that with the family and with the patient so that they can keep this as a memory and build new memories with this in their possession. So this is a therapeutic process. We consider it part of the grief journey. It's tender, and it's really important that we don't see the heartbeats just as a product, but it's a piece of someone. And we try to honor that with every step of the process as we capture the heartbeats. So sometimes families will want to keep the recording as is and just hear the heartbeat. Sometimes we'll record someone singing a favorite song and overlay that music with the heartbeat recording. Or we can align the heartbeat recording with pre-recorded music, someone's wedding song or a lullaby that's really important in the family, and share that with the family. We can record multiple family members' heartbeats and create a collage with those to share with the families, or overlay the heartbeats with home videos so that families can see their loved one, hear their voices, and hear their heartbeats while they watch a memory that's important to them. That's really powerful. For one of our pediatric patients who had lots of siblings, we were able to create a recording for the parents of all of their children's heartbeats on one recording that they've been able to keep. And it's really a remarkable experience. We're just so grateful for the resources that we've been provided to make these happen for the folks that we serve.
Thank you so, so much for that. And thank you to our community because, as Taylor mentioned, those are resources that make that possible. And so we thank you for your support. And just think about the impact that would have on you and your loved ones if you had a gift that you would be able to continue to listen to year after year. And I'm so grateful that our music therapists make that possible for those families and patients who would like it. You know, when we think about what we do to co-create the best care every day, again, it starts with that question of what's most important to you. And every single day with every one of our care team members that go in, they ask that question or a question similar because what's most important to you today may be different than the next day. And so when I think about co-creating the care experience, the term innovations comes to mind. And it's not innovation just to innovate. It's to say, what is possible for us to be able to learn or utilize, design, develop, offer, so we can provide the best care possible, better care than even before. And so I'm just wondering if there are studies or if there's innovations in the music therapy space that you would say, love to share with listeners.
Absolutely. So in hospice, we're, as you said, always looking for innovative ways to relieve symptoms, to promote comfort. And there are some ongoing studies in music therapy using fMRI and EEG to really understand how music affects the brain and to quantify that, to see exactly what's going on, especially related to pain perception and memory and emotional regulation, things like that. And these investigations aren't new, but as technology changes, we learn more every day about how best to support patients and families, how to directly and in a very intentional way align our music and the interventions that we're using with the outcomes that our patients and families want to have. Also, as in any field, I imagine there's a push to explore technology, so artificial intelligence and virtual reality, to see how they might play a part in the care. And so I've read about some exploration into immersive relaxation experiences or wearable technology that responds to the body with changes in music and sound. Tools to support families in building playlists that could encourage a desired feeling or a desired experience at home. So I'm excited to see how those tools will develop and how they will fit into the world of clinical practice. I think the concept of automated healthcare can raise some eyebrows, right, or cause some questions. But I think it's worth exploring because I think as we try to make good care accessible to everyone, there's so much to be explored in terms of how technology can be a support and provide patients and families with empowerment to achieve as much as they can on their own with training and with that clinical support on the outside. And then there's also an ongoing push for broader insurance coverage for music therapy services, both inside and outside of hospice care. And it's hard to quantify some of the outcomes of what we do because so much of the work is subjective and experiences are so subjective. Things like a spiritual experience or grief support, they're hard to measure. So there are several studies looking to better standardize protocols and better quantify outcomes to determine how we might, again, be more intentional about applying and measuring the work that we do. And because I mentioned insurance, I do want to clarify that all Four Seasons hospice patients do have an assigned music therapist included in their care team from the time of admission throughout their duration of care. And Four Seasons has continued to ensure that all of our patients have the same access to music therapy services with no additional cost to them. And that's very rare in the world of music therapy. So I think that's worth mentioning.
Thank you for sharing that. You're right. I'm so grateful that for our hospice patients and families, we're able to offer that because the impact is so important. And it makes me think about oftentimes our focus is the positively impacting lives and how can we do that even better. And so I would love if you'd be willing to share with our listeners a story perhaps of how music therapy helped to positively impact a life of someone that we've served.
Yes. So one patient in particular comes to mind who really engaged with every facet of what music therapy can be. So without over-disclosing, this person experienced a lot of dyspnea or shortness of breath, trouble breathing associated with their illness. And as we know, for many folks, trouble breathing is often accompanied by anxiety. The body makes note that something's wrong, and the mind will respond to those physical signals and try to place those feelings. And then there's a cycle, right? When we can't find a reason for that feeling, one symptom compounds the other. And this was true for this person. So as a hospice team, we approached the problem from several different angles. And in music therapy, first, we used music-assisted relaxation, which is one of the interventions that we use quite a bit, and entrainment to change the respiration rate of this person to focus on slower, more regular, more measured breaths. And when this person was more relaxed, we were then able to use verbal counseling and music-assisted counseling to unpack and process the cognitive elements behind that anxiety to help them to understand where these feelings are coming from and how to put speed bumps, so to speak, in the process just to help them to have more control over their own experience. So once we had determined what their coping strategies were going to be, we created posters and put them around the home so that they had visual reminders then of the work that they had done. And we shared these same reminders with all of the members of the Four Seasons team so that everyone who came into the home could share in reminding them, you know how to get through this, you know how to overcome these feelings. And the nurse got involved and helped to provide medication support to manage the symptoms, to help manage the shortness of breath and the anxiety. And the chaplain got involved to support spiritual exploration around the questions that might have come up. So it really was a full team effort. And we were able to use music therapy also to support life review with the patient and their family. So in the midst of managing all of these symptoms, we're also creating new memories and creating an opportunity for the family and the patient to have some good experiences amidst all of these changes that were going on. And it was really beautiful to see how the team came around this patient from every angle to provide every possible facet of support. And it was great to be able to adapt the music therapy interventions to support this person through every piece of that journey.
What a tremendous example of co-creating the care that's most important to that individual and to the loved ones. Thank you for sharing that. And Taylor, I think that you might have something else that you'd like to share with listeners before we end today.
Yes. So
Thank you.
as I mentioned before, we use songwriting quite often in our music therapy visits. And so I've brought an example of a song that would be a very typical example of what we might write in a visit. And I have spoken some to the area where we live and we work. I'm very inspired by this area, and I think that our patients and families are too. So lots of the inspiration you'll hear is from Western North Carolina. But I would invite our listeners to consider not only the song itself, not the product, but the process by which this song would have been written. So what conversations would have taken place? What questions would have been asked? What feelings and emotions would have bubbled up, and how would they manifest? And how would the work be done between the music therapist and the person receiving care? And in what ways would that process shed light on and bear witness to an experience that so often happens in darkness or in solitude? This is where we see the impact of music therapy and hospice. It creates a safe space where the implicit, again, can be made explicit and the internal world can be shared and observed and honored. So the song is called Seasons, and I'll share it with you today.
rests her gleaming brow on fields of gold. The leaves all die in color. Does one feel better than the other? Or do they all feel best when they let go? A road named for a creek that washed it out. A street named for a tree that's been cut down. A holler named for some old church that's barely standing now. A heart claimed by the past that beats somehow. A heart claimed by the past that beats somehow. The rain, it falls forever in the springtime. The peaks are buried deep in fog and steam. The hills, they need this season to soften and to deepen. We can't see it, but we know it. In time, the seasons show it. Beneath her shroud, the mountains ever slowly turning green.
Thank you so much for joining us today on our podcast. And for those of you who are wondering, how can I find out more? How can I access care? All you have to do is go to our website or call Four Seasons. We are so grateful to you being with us today, Taylor, and we're grateful to our listeners. So please know that we are here to help you, and all you have to do is contact us. Thank you so much.
The Quality of Life podcast is produced by Four Seasons, the care you trust, providing award-winning quality hospice and palliative care to Western North Carolina. For more information, visit fourseasonscare.org or call 866-466-9734.